The cervical cancer, they say it takes between 7 to 20 years before it develops. That's why it's very important to go for pap smear, because then they can get it while it is still there. Once it is still there, they can just do surgery and they take out the uterus together with the cervix. And then you don't need any other treatment. Now let's imagine, for example, you are having a house. The house made up of bricks. The house is the body. You have got bricks, and the bricks represent the cells. In the beginning, if one cell dies, it's replaced by another cell, exactly the same size, the same shape. Some mutations take place, and in the place of one cell now, two cells comes into the place. And when they divide again, there are 4. When they divide again, they become 8. And so this thing now, it forms a tumor, and that growth is now what we call cancer. The treatment that we give here is 2 phases. The first one is we concentrate on the cervix together with the lymph nodes in the pelvis. It takes between, depending on the stage, we can either give 10 days or 25 days. That's the 25 days is what we do radical. Radical treatment means you are giving the treatment with the aim to cure. So they go to the machine, and then you treat the whole pelvis for 5 weeks. And then once the 5 weeks are completed, they now come to this machine here. This machine is called a high dose rate. High dose rate means it gives a very high dose rate. So what we do when the patient come in, before they come in the room, they are injected. The injection means just to calm them down and also to decrease the pain. They come in here, lie on the bed, then we clean them very nicely, and then we put the instrument into the cervix. So we connect these instruments, and then they go into here. So this whole process now is how we treat the cervix. So it moves like from one step to another until it reaches up to where we have planned. Then once the treatment is finished, it goes back and the treatment is completed. For prostate cancer, we exactly treat it the same way as cervical cancer. You also have 4 fields. You have got one from the front, one from the back, one from the right, and one from the left. So the machine moves also around the patient, just like in cervix. Each organ has got something called a tolerance dose. If you give too much high dose, you'll cause more harm. For example, if you give a higher dose to the bladder while you are treating the pelvis, you might cause something called a fistula, where you get a hole through the bladder and then the bladder will just be leaking. Let's say, for example, you are having a patient now on the bed, and then we are busy with the treatment, and you open the door, then the treatment will stop. The treatment won't take place before the door is closed. So what happened here, we can see the patient on the bed. If there is any problem, the patient will let us know and will communicate. This machine here is called a simulator. It simulates the treatment. If you just put the patient on the bed, to make him straight and don't move the whole time is impossible. So we use this thing here. This one is called a mask. So what we do is we put it on the head. So depending on where the cancer is, let's say it's in the mouth, then we have got some borders that we follow. The reason for making a mask is to keep the patient in the same position every day when we are treating. For example, maybe if you are treating the pelvis, they must keep their hands on the chest every day during the treatment time. Or if we are treating maybe, let's say, up, then they have to keep their hands up. So every day you have to do it the same way.